Okay, so I'm going to go ahead and get started. If we have any other participants, we'll let them join in. My name is Aisha. I am the CPR instructor for Family and Friends, brought to you by AMWPA. Can everybody hear me okay? Let me just drop me a message in the comment box if the video or the voice quality, anything is going off on there. So we'll go ahead and get started here. The first slide you'll see is a copy of our book that we use with American Heart Association. This class is called Family and Friends CPR. It is strictly a community type CPR to help educate the community on how to react someone goes into cardiac arrest. Just a disclaimer that this class doesn't offer a formal certification for an employer or at a hospital. It's just for informational purposes only. The other thing here is we have a class roster that we usually use in our live classes when we present these at the masjids. If we're not able to do that at this time because of the coronavirus. And so due to that, whenever you guys are able to, I'd like to have you just drop your name and email in the comment box so that I can go ahead and forward that over onto a class roster for reference purposes. One thing about our association, this is AMWPA. It is our main organization that brings these classes to the community. We're trying to bridge the gap at this time with the coronavirus because we're not able to reach our community live. And so we're trying our best through the Zoom app in order to present these virtually for the community. This is our website that is available. You'll see the main page here. Our president is Dr. Seema Huq. A little bit about the vision and mission for our organization primarily is to help promote the health and welfare of our community, as well as educating young Muslim females as well wanting to enter into the healthcare field. The main page, you'll see if you have any questions to contact our you can go to www.amwpa.org and there's a free text if you have any questions or concerns that you'd like to reach out to our organization for. Now, name part here for our class today, this is a CPR class. Now, what does CPR stand for? It's short for cardiopulmonary resuscitation. Cardio meaning heart, pulmonary meaning lung, and resuscitation meaning life-saving technique. Now, what happens when someone is going into an event that's requiring CPR? In essence, it means that this person has stopped breathing or their heart has stopped, and then they need this life-saving technique to help restore oxygenated blood flow to the vital organs. Now, a couple of things that some patients will ask or students will ask us is cardiac arrest and heart attack the same thing? They're used interchangeably, but actually they're not the same thing. So just a short kind of intro here. When cardiac arrest presents, it's actually an issue of an electrical issue within the heart, that something has malfunctioned and it stopped beating unexpectedly. When this occurs, we have to act very quickly, within seconds if possible, in order to prevent a death scenario in the patient. Number one thing we want to do is make sure to call 911 and act quickly. Now, what's the difference between cardiac arrest and the heart attack? Heart attack is actually a circulation issue. It's something where there's a blockage for the perfusion of the heart, and it creates also a life-threatening event that can occur, and sometimes in scenarios when it is bad enough, it leads to a cardiac arrest event, but they are different in nature. What we'll focus on is the cardiac arrest portion of this class. It will present as a video portion and a return demonstration, so it'll be broken down into a couple dynamics here, which I'll show you actually on this slide here. So, sorry, apologize. So on this here, you'll see we'll have an intro video called Life is Why, just a short intro about why American Heart Association focuses on educating the community on CPR and stroke prevention as well. And then we'll have a short session on adult CPR and how to use an automatic electric defibrillator device in order to help someone that is requiring a life resuscitation scenario. And then adult choking, just kind of short, because you might see some scenarios of this in the community and how to react in that scenario. The other portion will be child CPR and how to use an AED on a child choking, infant CPR, and choking as well. A short thing that's not in a video, but we like to present to the community is how to use an Epi Pen. So I do have the Epi Pen here that I'll show you at the end of class on how to use in a scenario that someone has an allergic reaction and they're requiring this life resuscitation kind of medication. What we'll go ahead and do at this time is go ahead and play our video portion of the class. This is required by American Heart Association for the Family and Friends class participation. So it'll be a short video. I'll try not to present the whole video so it doesn't prolong the class, but we'll do a video portion and then I will do a return demonstration so that we can visualize how this looks like. We're a bit limited on allowing for return demonstration for the students because of the coronavirus, but I will present the how you would normally see it in a real class and how we would check the students off ideally. Let me go ahead and I'm going to transition to my video screen at this time so that we can play the DVD here. And so this first video is going to be just a 2-minute clip on Life is Why, which is just a short intro from the American Heart Association. Okay, so the next portion will be the main bulk of the class, which is the adult CPR module. I am required to play the whole video in entirety for the class purposes. And so it's about 9 minutes long. I will play that through and then I will do return demonstration for the class. Once again, if there's any issues with the video on sound or image quality, please drop me a message on the comment box. I'm going to go ahead and pause at this part and go ahead and show you on a mannequin at this time. So let me go ahead and just set that up here. So this is what we typically use in our classes. This is our adult mannequin that we'll use to practice on in class sessions. On the this side of the shoulder, you'll have usually a green lights that'll come on. And as we do the class, we're able to gauge if the compression depth and the rate is adequate enough when we're practicing on the mannequins. So in the class, as you saw on the video, what happens in a scenario, apologize, just. Okay, so what we'll see here on the video is you had an adult patient collapse and they became unresponsive. So what's the first thing that we need to do? Actually, the first thing you have to do is make sure the scene is safe. If the scenario occurs where there's an electrical wire or some kind of fire, you want to make sure that you are safe first before you approach that person to help them, because if not, then we'll have two people in a scenario that's needing help. And so we want to make sure the scene is safe. The next thing is you want to check responsiveness. And so the way we do that is pretty universal. I'm going to bring the screen down a little bit here so you can see. So the best way I can always remember is if you tap the shoulders and say, hey, are you okay? So whenever you do that, you want to see, okay, are they blinking? Are they responding in some way? If they don't, that means that they're unresponsive and they need help. So the next thing that you want to do is check if they're breathing. So the way that you do that is you gauge the chest rise and fall. Is it going up and down? Now you saw in the video that there was a patient that was gasping as agonal breaths, like that doesn't count as real breathing. So if you see that, or you see an absence of chest rise and fall, that's safe to say, okay, that they're not breathing. Sorry, one aspect actually I missed was when you check the responsiveness and they're not responding, you actually want to call for help first before you check for breathing. And so you want to call out and say, call 911 and go get an AED. You want to be very clear whenever you're in a crowd to make sure that you're looking at one person and you say, okay, you call 911, you go get the AED so you know that your help is on the way. Then you'll check for the breathing to see, are they breathing okay? And then what you're going to do is when you've checked that they're not breathing and that they're not responsive, you want to go ahead and start your compressions. So the way we do that is you want to aim for the center of the chest right here, just below the nipple line. That's where you want to aim for your compressions, because that's the area of the heart that you want to be compressing. You don't want to be down here by this. You don't want to be up here. So right around the middle of the nipple line here. And you're going to put your hand one over the other like this, and then make a fist. You want to make sure your elbows are locked straight when you go in. And so I'm going to bring this down here a little bit. And then you're going to count to 30 and then give 2 breaths. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 28, 29, 30. And you'll see that there was some lights that came up on here. And so that's basically what you'll see usually in the class. As we're compressing, you'll see those green lights come about as long as you're doing a hard enough depth of compression and you're going quickly enough there. Now, the next thing that you'll do is give breaths. There is a separate video in the class for the breath scenario. They don't show it, and so it can prolong the class. That's why I'll usually just demonstrate it on the mannequin. The compression rate you want to do is about 100 and 120 compressions a minute. That can be a little bit difficult to gauge when you're trying to do the compressions yourself. And so a good rule of thumb is what we'll usually do is give 30 compressions and then give 2 breaths. 30 compressions and give 2 breaths. With that ratio, you're able to meet the adequate amount of compressions per minute. Now I'm going to go ahead and show you the breaths that you'll give. So once you've given 30 compressions, you're going to, go ahead and give the breaths here. We have a face mask that we have usually in the class to help assist with this on the mannequins. The way that you want to place the mask, I'm going to bring this down here, is you have the mannequin here, and you want to put this white patch just on their mouth here, and then you want to actually tilt the head up to open the airway actually. So you're going to, it's called a chin tilt method, that you're going to go ahead and bring the chin up, try to pinch the nose here, and then you're going to put your mouth here and give breaths, and you want to watch for chest rise and fall. So let me go ahead and do that here. And so you'll see this rise here. So I did it a few times that we can kind of see that chest rise and fall. Ideally, you'll do 2 breaths. Once you've given 2 breaths, you're going to resume to your compressions. And you'll do this until an AED or the automatic external defibrillator arrives, so that we can give the place that onto the chest. I'm going to play that video first before I show it to you, and then do a cumulative return demonstration so that you can see the full scenario in action. Let me go ahead. I'm going to pull up the video here for the AED portion of the adult scenario. So just bear with me here. Okay, so now this will play the portion of how to use an AED. Okay, so that was a short portion about the AED. I'll go ahead and bring this out here. So this is just a kind of a demo AED that we have, nothing compared to the real thing that's used in hospital settings. But this kind of helps to gauge what an AED would function as. Now, when you're doing your compressions and you've called for help, the AED is coming. When it finally arrives, what's the first thing that you need to do? Very simple. The AED talks you through everything. So the first thing you have to do is just turn it on and it'll talk to you throughout the scenario.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
Okay, so I'm going to just pause that here and show you that on the mannequin.
Apply pads, plug in connector.
So you have your mannequin that's here. Now, where do you want to place the pad? So it says place your pads onto the bare chest. You have two pads that are going to be given to you. One pad has to be placed on the upper right chest, and the other one laterally or on the left side here. And there's actually pictures that are going to be on the patches itself so that it guides you exactly where to put these pads on the chest. So I'll do that now here. And then you have the connector, a plug that you have to put into the actual AED machine. And you're going to just plug it in as it will tell you.
Analyzing heart rhythm. Do not touch the patient.
So once you plug it in, the patches start analyzing the heart rhythm. You do not want to touch the patient at this time so that it has adequate allowance to analyze what's going on. And then it'll tell you that a shock is being needed and that you need to shock the patient. So whenever it does that, you'll see that it'll start charging and then a light will start to flash when it's ready to actually shock the patient.
Press the orange button now.
So you'll want to press that, but before you do, the first thing that you need to make sure is you yell clear. You don't want anyone touching the patient before when you press the shock button. So you'll put the machine down, you'll yell clear, make sure no one is touching, and then you're gonna go ahead and press the shock button. Apologize.
Analyzing heart rhythm. Do not touch the patient.
Sorry, it has to charge again here.
Shock advised. Charging. Stay clear of patient. Deliver shock now.
Okay, so I'll yell clear, and then I'm going to go ahead and press the button.
Shock delivered.
Okay, so you'll hear that the shock is delivered. What do you do right after the shock is delivered is you need to resume compressions right away. Any interruption in compressions can impact the survival of the patient. As soon as it's delivered, you leave these patches on, and then you'll go ahead and give the compressions. You do that cycle until we see that the patient has resuscitated or emergency services has arrived to the scene, and they'll take over. So that is the main part for the adult CPR section. I'm going to go ahead and move to the adult choking and the child CPR section. At the end, I'll go ahead and do a full return demonstration of the adult for anyone that missed it, so that we can see the whole scenario together. Let me go ahead and just play a short video here for the remaining CPR class that we have for adult choking, and then we'll do a child CPR and infant CPR section. Just loading. I apologize, the DVD is just a little slow here.
Analyzing heart rhythm. Do not touch the patient. No shock advised. If needed, begin CPR.
Okay. All right, so this will be just a short clip about 2 minutes long on choking, and then I will return demonstrate that to the class. Okay, so I'm just gonna go ahead and stop that here. I'll go ahead and show you the actual scenario when someone is choking. Let me go ahead and exit the screen share here so you can see. This is, bring this out a little bit. So someone is choking, they're still responsive, but they've had something come into the airway and now they're having a difficulty breathing. So the universal sign that you'll see when someone is choking is they'll typically do this. They're like, I can't breathe, but they're trying to speak, but they can't make words, or they're trying to gasp for air. You do have to act very quickly in this scenario as well, because if they're in that situation long enough, then it can cause this airway obstruction. And then they could also even go a scenario that they need CPR. And so main thing is when they have this occur, you saw kind of in the video, when you do upward thrust, it helps push the object out of the airway by giving that upward pressure. And so the way you do that is you'll make a fist like this, and you want the thumb side of your fist to be on the person. You want to kind of just go above the belly button, and just, you know, below the breastbone here, and put your hand here. And then you want to wrap your arm around your fist and give upward thrust like this. So I'm going to kind of go around here so you can see, and you'll give upward thrust until the object can come out. And so I apologize, give me just a minute here. Okay, so that's basically how you'll give these upward thrusts and to help the object come out. If it doesn't work, you know, and if the object is quite dislodged in the airway, eventually they might go into that scenario where their lips will turn blue, they lose consciousness, and then they go into an event where they need CPR. In that scenario, you're going to lie that person down on a hard, firm surface and go ahead and do chest compressions in order to kind of switch, you know, into that new role. Sorry, I apologize, just a minute here. Okay. So, and then the main thing is when in that scenario, when you switch to a CPR event, you know, after someone was choking, you'll see that the object might eventually come close to the upper out of, you know, with the, to the upper airway, into the mouth. You don't ever want to do a blind finger to like go into their mouth and try to pull that object out. The reason for that is because you'll sometimes push it back further down and it causes more problems. You want to wait till it comes to the rim of the mouth and then pull the object out. So that's specifically for, you know, adult choking, and then if it converts into a CPR event. The next portion of the video or the class is going to focus on looking at what happens when a child goes into an event needing CPR. It's very similar to the adult. I just show a short clip of it just because it is very similar. The only modification is because their body is a little bit smaller, rather than doing a two-part compression with both your hands, you can actually do it one-handed using this part of the palm and doing one-handed thrust. And you'll see that in the video. So I'm going to go ahead and play that so you guys can visualize it. After that, there will be the child choking, very similar to this adult choking. It's just that they're a shorter stature. So usually you'll just have to kind of bend down on your knees and then do the chest compression that way, which the video will show. And then lastly, we'll have the infant CPR. And then I'll do a cumulative return demonstration for the class there. So let me go ahead and I'll go ahead and change the screen here to the video again. And I'll go ahead and pull up the child CPR portion. about that. Let me just see. This DVD is a little bit slow here. I'm just going to try to exit out here again. So this is going to be the child CPR video. I'm going to play about just about 3 or 4 minutes of the video clip here. Okay, so I'm going to bring this up here. Okay, that's just kind of a short portion of what the child CPR looks like. As you can see, it's very similar to the adult CPR. You'll see kind of on this clip here that the dad has his hand, just one-handed, and he's doing compressions. That's optional that you can do just because it's a smaller body surface area, or you can do the two-hand method. Both ways are perfectly fine in that scenario. The chest compressions you kind of saw visualized in the video, that 30-to-2 compression ratio of 30 compressions and 2 breaths, 30 compressions and 2 breaths. So that kind of helps visualize it in the video here as well. A very nice way to kind of gauge whenever you're performing this act to kind of help make sure you're going at an adequate rate. Because the video will commonly say do 100 to 120 compressions a minute, and that can be a little bit tough to count. So if you fall at 30 compressions to breath ratio, that helps quite a bit to make sure you're doing an adequate amount and rate for the patient. Now you'll hear that the chest depth when you press down should be about 2 inches. That applies here in the child and adult scenario. That can be hard to gauge. The best way we tell our students is just make sure you're going hard and fast. That maybe you're going down enough in order to compress and allow that adequate compression depth. And then you want to actually allow for a recoil too. So you don't want to go too fast like this, but an adequate rate, so that you can kind of visualize that you're compressing, mainly compressing that heart for the person through this compression act, and you're allowing for the adequate refill as well whenever you let go. And so that's the main thing, is hard and fast, but try to get, pace yourself that 30 compressions to 2 breath ratio, and that'll help make sure that you're not going too quickly either, but you're going fast enough to make sure that they're getting the right amount that the patient needs. Now, the next part is the child choking video. Just a nice way to visualize compared to the adult choking. There's a video on that, so I'll go ahead and play that here on the DVD. And we don't usually do like a child. We have an infant one because it looks quite different, but we don't usually do the child mannequin just because it's very similar to the adult portion. Later in the class, we'll have the infant CPR, and so we do have a mannequin for that, which I'll show you how to do in that scenario. Let me go ahead and pull up the child airway block here. This is a short video on child choking so that you can view what that looks like. So yeah, that kind of helps visualize nicely in a child. You saw kind of compared to adult choking, just because of the shorter stature, that you'll basically just go down on your knees to approach that adequate, body surface ratio, and you'll take your thumb and put it against the part of above their belly button. You'll go ahead and grasp around and then give upward thrust in order to help get the object out. The one thing I also wanted to show you is child AED. It is a little bit different than adult. There are patches similar like this, but in children less than 7 years of age, they have smaller pads. So I'm going to go ahead and play that here for you so you can visualize that as well. It's a little video, so I'm just going to fast forward a little bit here. So this is a portion on the AED on a child that I'll play at this time. So I'm just going to pause it here. It gets a little bit repetitive, but it's a nice way that you can see the AED use in a child. The pads that for child that they look like, they pulled out here. So this is just a sample pad that we have for the child, and you can see when they're quite small, when instead of having to put it where you have it on one part of the chest here and the other part in the adult. In the small children, you'll actually put one on the front of the chest and one behind on their back. And that's how they'll have it basically in children 7 years of age or younger. And then anyone that's 8 or older, or they've hit puberty, or they're an adult, you're going to use these adult pads. And you'll see that the picture here, it's at the right upper corner of the chest here, and then one around the left lateral aspect of the chest there. If you don't have child pads, you can use the adult pads that they mentioned. Just make sure that, you know, if it's really large on their chest, you want to put one at the front of the chest and one on the back, kind of how this picture is, you know, for the child. So you'll basically just make sure that one's on the front and then one's on the back if you're using an adult pad on a child. One thing that, you know, with AED that I kind of missed mentioning for adults, when you have a man that has a hairy chest and you're trying to put these on, it can be a little bit difficult to get the adhesive to kind of stick to the chest there. And so a lot of times you'll see in these AED kits in the hospital, the main thing is that it'll have either like a razor or something to shave the chest. If they don't have that, they'll usually have 2 sets of pads. And so you actually use one set, you'll kind of wax the chest, you'll put it onto the patient and then pull it off, and that'll help wax the chest there. And then you can use your second set of pads to actually use for the AED portion for that. And the next thing here, I just wanted to show you was the infant CPR. Is the last portion of the class here. It should be just about 10 minutes for that, and then I'll do just a cumulative return demonstration on our adult mannequin and infant mannequin so that you can visualize that as a return demonstration here. Let me go ahead and pull that up here. So the remaining portion's a little repetitive from what they've showed you. I'm going to go ahead and show the demonstration on the mannequin so that you can see what that looks like. Okay, so this is our infant mannequin that we have. You'll see it's a little different than the adult. When we have it in the class, the diaper portion here is what kind of helps look at the lights if we're going fast enough when we do compressions. And so with the infant, there's quite a bit of differences when we do the CPR. Main thing is whenever the infant collapses or they're in an event that they need CPR, they can't talk to you. So the main thing you're going to be looking for, are they cooing, are they crying, to check for the responsiveness. Ideally, you don't tap the shoulders. The best way is actually the heel. You're going to tap the heel and see, okay, is the baby responding? And if the baby doesn't respond, then that means that they know that they're needing CPR in this scenario. The next thing that you'll do is call for help. Call 911, get it on speakerphone. If you're on public, similar to the adult scenario, you're going to say someone to call 911 and someone to go get an AED. Once you've done that, you're going to check for breathing. Very similar to the adult, you're going to check for the chest to rise and fall. And if you don't see that, or you see sometimes these agonal breaths like, then that means they're not adequately breathing and you need to start compressions. The other difference between the adult is that you don't use the two-hand method. You actually are going to use 2 fingers. The placement is going to be about the same, this mid area here, in the middle of the sternum here, in the middle of the nipple line, just kind of below it right here is where you want to aim for compressions. You don't want to hit the stomach and you don't want to be up here. So you just want to be in between the nipples, just below that nipple line there. And so main thing is you'll take 2 fingers and you'll put your hand here, and then you're going to press and count to 30 here, and you're going to look for these 2 green lights. When we're usually practicing off, you'll see these 2 green lights on the diaper, and that means you're going deep enough and fast enough. And so same thing about 30 compressions and then 2 breaths. And so you'll go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And then you're going to give 2 breaths to the infant. Same thing, you're going to lift their chin up to help open the airway. And then you're going to put this here, and then go ahead and wrap your mouth around both their mouth and nose, just because it's very small. You can go ahead and wrap your mouth around the mouth and nose and breathe in. So it's a little bit hard to see this on the actual video, but the main thing is you want to adequately see that chest rise and fall as well. Let's see. So I did it a couple of times, but yeah, it's a little bit harder to see on the video. And then basically you'll go back into compressions and then breaths. In our BLS classes, they're a little bit different. You'll hear about 15 to compressions to 2 breath scenarios with 2-person rescuer. We kind of throw that out with the family CPR. The American Heart Association just mentions focus on 30 compression and 2 breaths. Follow that method for the purposes of this class until help can arrive. The best thing is calling 911 and putting it on speaker mode, and they'll guide you as well throughout the whole thing until emergency services can arrive. Just very quickly, because infants do have a propensity to choke quite a bit, the way that you help an infant with choking is quite different than a child. So I'm just going to play that clip here really quickly. It's about just 2 minutes long. And then I'll just do a kind of a cumulative adult return demonstration of CPR so you can see that on the mannequin with the AED clearly here. Let me go ahead and just switch to the video here really quickly, and we'll play that for you. Okay, so I'm just going to show that portion here on the infant choking. So if an infant is choking, the way that you actually will help them is you want to put them on your thigh, actually here. So I'm going to bring that up here. And you want to hold the head to support it. Make sure that they have adequate head support. So, ideally kind of hold that head to support the neck there. And then place that on your thigh here. And you want to use this portion of your palm to give the back thrust adequately. And you'll do 5 thrusts. So you're going to hold the head, place it kind of on your thigh, and then give the thrust downward motion. 1, 2, 3, 4, 5. And so then after that, you're going to hold the neck to support it, bring it onto your arm, and go ahead and push your hand in the center of the chest, like how you do compressions. 1, 2, 3, 4, 5, and then you're going to switch again. You can either do it onto your thigh, or you can go ahead and use your arm for support, but you want to make sure to hold that neck to adequately support the neck there, and then thrust again. 1, 2, 3, 4, 5, and then 5 compressions. 1, 2, 3, 4, 5. Now, this main thing is, you'll try to do this if you can get the object out. If you don't, then the baby will eventually need CPR, and then you'll switch that back to the CPR mode and put them on a firm, flat surface and give the compressions and breaths. Same thing with the adult scenario. If they go into CPR, if you see the object come up, you don't want to do a blind finger sweep, so you don't want to dig your finger in if you see it. You want to wait till it comes more to the rim of the mouth, and then you can pull the object out. So that's the main part for the infant CPR and infant choking scenario. The main thing is for the Epi Pen that we were talking about here. This is an Epi Pen that you'll see very similar to the actual prescription. It's just a trainer method. And so this one basically is very easy to use. A lot of people might have like allergies to peanuts or, nut products or something or the other, and they might need this medication. They keep it on hand very often. And so the other thing is you want to just make sure to look into their purse or their bag if they're going into scenario. You'll pull this out here, and then that's usually like a blue cap that you'll see. You'll pull it out, and then you want to make sure to take the portion of the thigh here. Right here, there's a kind of this lateral aspect of the thigh. You want to hit that right in the middle. And so the main thing is you want to go into a 90-degree angle. So you'll go ahead and press into the thigh here in the mid thigh, 90-degree angle. You hold that in for about 10 seconds, and then you'll let it out. And then the medication will release, and then basically a safety lock kind of comes out to help retract the needle, and that way it's safer. Whenever you give the medicine, please be sure not to hold your hand close to the needle. You want to make sure to put your thumb on the top part and then press and then let it out. So that's the epi portion part. Just very quickly, I'm just going to show the adult mannequin again here on the floor, just to give you a good a cumulative scenario on the adult CPR, since that's the main portion of the class that we wanted to focus on, and then we'll be done with the class there. And so this is the scenario of an adult patient on CPR. I've approached the scene, I made sure it's safe. I checked for responsiveness. Hey, are you okay? They're not responding. I'm gonna call for help. You call 911, you go get the AED, and then I check for breathing, check for chest rise and fall. I don't see that they're breathing, and so I'm gonna go ahead and start my compressions. I'm gonna put one hand over the other, use this portion of the heel, or of my palm, to go ahead and give the compressions. I'm gonna aim for the middle of the chest, just below the nipple line, and go ahead and lock my hands straight and my elbows straight. I'm going to give compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And then I'm going to go ahead and give 2 breaths. And I'm going to lift the chin up to open the airway, and pinch the nose, and then give 2 breaths. Okay, and then after that, I'll go ahead and resume my compressions. As I'm doing my compressions, the AED has arrived. So what I'm going to do is go ahead and continue compressions. The second person that arrives on the scene is going to turn that AED on.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
I got